Hello, my name is Sophia Alfaro Barillas, and my mentor was Jacqueline Aramco. Um, the name of my presentation is The Impact of Income and Education in Central America's Latino and Hispanic Communities, Intervention Strategies for Healthcare Performance. Having spent my entire life in Nicaragua, a nation grappling with socioeconomic challenges and the second poorest country in Latin America, I have developed a deep understanding of the issues facing our country. Here, 16.3% of the national population lives in extreme poverty, which leads to disparities that manifest in healthcare access. My journey into research was propelled by a desire to address these inequalities. Witnessing firsthand the healthcare disparities in my homeland served as a catalyst for my study. Through my work, I aim to shed light on healthcare disparities and propose effective strategies to improve health outcomes in marginalized communities across Central America. Central American countries struggle with socioeconomic impediments that range from poverty to limited access to healthcare and education. By addressing these issues, these communities can progress toward a fairer and wealthier future. As exemplified by a Cornell University literature review, estimating that obesity's total medical cost in the US is about $350 billion per year, a healthier community is more productive thanks to improved medical healthcare access. Similarly, a well-educated population can fuel innovation and
Sophia,
economic growth.
I'm so sorry, but I don't think we can see your full presentation. I only see a portion of it. So I just want to make sure we can see the full.
Oh, yeah, that's weird. Sorry about that. Can you see it now?
Now we can. Thank you so much. Sorry to interrupt you, but I wanted to make sure we could see your
Yeah,
slides.
of course. I apologize for that. Okay. So what is there to solve? Across numerous Central American nations, the struggle with health disparities remains entrenched, primarily driven by profound socioeconomic challenges. A study by the United States Agency for International Development underscores this reality, with the Central American countries of Nicaragua, Honduras, El Salvador, Belize, and Guatemala are ranking as the second through sixth poorest nations, respectively. In Nicaragua, for example, a substantial segment of the population grapples with financial limitations that hinder their access to vital healthcare services and education. Data from the World Bank utilize the Human Opportunity Index, or HOI, to gauge access to fundamental services while considering their equitable distribution. In 2014, the HOI for in-house access to running water in Nicaragua stood at a mere 24%. These challenges are compounded by inadequate resources and infrastructure in healthcare and education. As highlighted in Envio magazine, the average educational attainment of Nicaraguans is 5.6 years of schooling, shedding light on the significant obstacles in accessing access to quality education. Likewise, research conducted by the Inter-American Development Bank demonstrates a positive correlation between the proportion of trained teachers and the student academic performance at the primary level. So how does my study help? Sorry. By employing a literature review and meta-analysis methodology, my study aims to provide insights into the complex relationship between income, education, and various healthcare outcomes. Through graphical representations of each Central American nation's financial and health circumstances, my research sheds light on the unique conditions and experiences in developing countries, fostering a deeper understanding of the disparities present. This is so can people both living in these types of countries or wanting to help are able to know the circumstances of these countries in order to develop a more unique approach to address these situations. The findings highlight the urgent need for targeted interventions and evidence-based policy recommendations to address healthcare disparities in these communities. It emphasizes the importance of prioritizing healthcare accessibility to improve healthcare outcomes and reduce disease incidence. Ultimately, my study underscores the critical role of education and income in shaping healthcare outcomes so that with collective effort, we can ensure quality healthcare for all. How does my research contribute to my field in just three simple steps? Empowering communities. My study highlights the factors influencing healthcare outcomes, so it offers insights to organizations and community leaders that can potentially develop bigger scale treatments or approaches to this problem. Promoting equity. This study underlines the necessity of addressing both diseases and underlying causes of health disparities to foster a more equitable society and driving policy reform. As I mentioned before, being able to share my findings with research and leaders that are in positions of power is going to be able to help make bigger scale projects. Results and what do they actually mean? Healthcare access issues persist, particularly in rural areas where unmet needs are prevalent. For example, fewer than 10% of Nicaraguan hospitals serve rural regions. These locations make up half of the country's territory, making treatable diseases like pneumonia a significant threat. Economic disparities directly relate to healthcare outcomes. What we can see in this graph is that wealthier nations can often invest in superior healthcare infrastructure, preventative programs, and workplace development, leading to lower mortality rates. In comparison, lower income countries with limited healthcare access, like those in these box, suffer higher disease prevalence and mortality rates due to inferior healthcare outcomes. For instance, many deaths in Nicaragua would have been prevented because its biggest healthcare access issue is unmet needs. Finally, I elaborated a graph for the proportional mortality rates for each of the Central American nations in 2014, which revealed commonalities across most prominent diseases. Adjacent nations, for example, often tend to face similar healthcare problems and healthcare access issues. For instance, neighboring Honduras and El Salvador both struggle with diseases like dengue fever, as shown in these graphs. This is the next table, in which I found that 4 out of 6 Central American countries, El Salvador, Guatemala, Honduras, and Nicaragua, allocated less than $40 per capita. Conversely, only Costa Rica and Panama exceeded this figure, spending over $200 per capita. Comparisons between higher and low income Central American countries such as Costa Rica and Panama versus Nicaragua and Honduras reveal stark disparities in mortality rates. These discrepancies are fueled by differences in public health and spending, healthcare access, and disease prevalence. The lower income nations each spend less than 40 per capita, which is per person, on public health, adversely impacting healthcare accessibility and quality. On the contrary, Costa Rica and Panama exceeded $200 per capita, enabling better healthcare quality and outcomes. Policy and intervention recommendations. For healthcare, my proposed solution is for low-income nations to deploy mobile medical clinics in remote areas. For instance, Central America grapples with maternal and child health issues resulting in avoidable fatalities. Comprehensive maternal and child health programs should be implemented and include prenatal and postnatal care, sex education, and immunization drives, where the U.S. involvement has led to increased vaccination rates and reduced infectious disease prevalence in countries like Honduras and Guatemala. Adding to the issue is the growing prevalence of non-communicable diseases like diabetes and heart disease. Preventive and management measures such as public health campaigns and affordable medication accessibility need to be designed and implemented, tailoring campaigns to countries grappling with specific non-communicable diseases. For education. Improvement in education, and specifically teacher development, can positively impact downstream healthcare outcomes. With a solid educational background, individuals are more likely to make informed healthcare decisions, understand complex healthcare matters, and engage in healthy behaviors. My recommendation is equipping teachers with proper training in healthcare education so they can effectively deliver programs promoting hygiene, nutrition, physical activity, mental health, and disease prevention. Thus, their role extends fundamentally beyond the classroom and impacts the overall health and well-being of their students. Consequently, investing in education is a strategic approach to achieving better healthcare outcomes. In addition, teachers who are well-versed in science, technology, engineering, and math are well-equipped to educate the future generation of healthcare professionals, thereby enhancing healthcare services in the long term. My second recommendation emphasizes the significance of technology in education. By coaching teachers unfamiliar with educational technology, we can bridge teacher-student communication gaps, essential in the age of distance learning. A compelling example is Costa Rica's Educational Information Technology Program, which prioritized necessary infrastructure and resources. It included initiatives like training teachers in technology's educational use and incorporating digital resources into curriculum. Finally, this study marks significant progress in understanding complex relationship between healthcare outcomes, income, and education within communities in Central America. It intends to be a valuable tool for both people living in countries grappling with these issues and those advocating for global healthcare equality. The findings underline the immediate need for the formation of evidence-based policy recommendations to address healthcare disparities in these communities. Policymakers must act proactively to eradicate existing healthcare accessibility inequalities and acknowledge the critical impact of education and income on healthcare outcomes. Thank you so much for listening to my presentation. Do you have any questions?
Thank you so much. And Just as a reminder, you can add questions for Sophia in the chat, or you can raise your hand to speak. And the question actually I have for you, Sophia, so you have a lot of recommendations based on the research that you've done. What do you think is the most likely recommendation that countries would be able to put into place, either healthcare-wise or education-wise, that would make the biggest difference?
Yeah, I think the one that will make the most difference is deployable mobile clinics, because that's something innovative that doesn't cost a lot with enough budget. And it's something that can definitely help. Like in countries like India, sometimes people can't even go to hospitals because of distance, like really large distance, things like 5 hours to travel to get to a hospital. So being able to have smaller clinics next to you can really help, like in a life or death situation.
Amazing.
Thank you.
Thank you so much.